Medicaid expansion would allow 20,000 vulnerable people to have access to health care, and that's why I think it's so important that they'd be exposed to health and wellness that they don't have access to right now. Of the 20,000, I would say a significant portion most likely live here in our county, and what that would allow them to do is instead of using the emergency room for urgent, emergent visits, we could connect them with our primary care providers, and what primary care means is wellness visits for them. So I think of my son, he's in his early 20s, he's covered with me. If he gets a entry position that doesn't offer insurance, that's a subcategory that we could help right now. So he'd have his wellness check every year, just make sure his blood pressure is under control, his diet, his weight. It just is such the right thing to do for these people. I talk about this a lot. I just was at the nurse day at the legislative session. I don't see it literally as a political party decision. I'm a nurse by background, and part of our code of ethics is you're an advocate for vulnerable people. And so for me, it's a model of healthcare that the federal government is absolutely supporting. So I understand we don't want to be dependent on the federal government. Having said that, let us use the money that we're paying as taxpayers to help a vulnerable group of people get health care. And I loved how Governor Meade put it in the budget, so it's sunset. So after 2 years, if the funding isn't there from the federal government, we're not obligated as a state to fund yet another program. So I love the approach that the governor has taken. And again, by just my pure nursing background, to me, it makes good sense to take care of 20,000 people. And the other thing that's interesting is we've watched with our population health grant that you can make a difference in life choice and behaviors even after 90 days. So the idea that this won't make an impact for these people is absolutely not true. And I have confidence because I got to watch the good work that the Wyoming Institute of Population Health has done for people, and it will make 20,000 people healthier, and that, I think, is worth it. To me, the variable that has changed is our state economy. And so just on that fact, it's going to sunset in 2 years on the budget. It could even do it in a year. We're not going to be dependent forever on the federal dollars because it's built in the budget. Our economic status has changed, and if we bring Medicaid expansion in, it will allow them not to make other decisions that they're going to be forced to make given our economic downturn. To me, is the exact right time for us to look at it because of the economic variable that has changed in our state. I think just get educated on it. Again, I don't think it's a Republican or Democratic issue. I think you really have to weigh all the factors, and like I said, economically, we need another source of income. The governor has done a beautiful job on making it limited, and yet it's going to help those 20,000 people.